I'm going to tell you exactly how I manage sliding scale appointments in my therapy private practice, but I have to tell you, every single time I post about fees as a therapist, I get some honestly gnarly hate comments. So if you love videos like this, please introduce yourself in the comments. My channel is still really small. I appreciate comments from every one of you. Tell me your questions about setting your fee, and let's talk about sliding scale. For those of you who don't know me, my name is Kelley Stevens. I teach therapists how to build thriving six-figure private practices. There's more info about all of my courses and programs, but I wanted to pull the curtain on how I manage my sliding scale spots as a therapist in private practice. Now, when I first started working in private practice, I will tell you, I was sliding my fee all over the place. I was definitely not confident in what my fee was. I was nervous about charging it. And if clients even expressed like a little bit of discomfort or just said, oh, or something like that, I would automatically slide my fee. Now, I have learned that that is not the best approach. Clients will sometimes express a little discomfort about my fee or something like that in a similar way that they might if they're going to see a massage therapist or a dentist or a chiropractor or something else. And it's okay. Just because a client might express a little bit of discomfort does not mean they necessarily need a sliding scale fee. And when I was thinking about my own private practice, I first had to pause and I had to say to myself, why do I want to charge a sliding scale? And who do I want my sliding scale to be open to? Now, this is something I really suggest when working in private practice, that you think about what your motivation is behind your sliding scale fee. So for me, that I wanted to be able to provide sliding scale spots for clients who made at or below minimum wage in my community. Now, not every therapist is going to use that as their criteria, but that is what I wanted to do. I also decided that I wanted my practice to be able to sustain spots that were for clients who made at or below minimum wage, and I wanted them to be able to pay what they earned for 1 hour of work. So let me give you an example. If a client earned $16 an hour in their job, then I want them to be able to pay $16 for a therapy session. Now, I am located in Southern California. As of right now, my fee is $250 a session. And so you can imagine that $16 for a session is significantly less than my normal fee. So the only way that I am able to do this is to do the math on my practice. And so I have other videos, which I'll make sure to link below, about how to calculate your fee, how to raise your fee. I also have a free guide on raising your fee, which I'll link below. But it is really important to do the math on what is sustainable for you and to calculate how many sliding scale spots you can earn while still meeting your income goals. I calculated that when I am working full time in my practice, so that's anywhere between 15 and 25 clients a week for me, that's what I consider full time, that I could have anywhere from 3 to 4 sliding scale spots every single week and still meet my income goals. I also calculated that in times when I wasn't full time in my private practice, so let's say times when I was coming back from maternity leave, I have 2 young little boys, times when they were really little, let's say I was seeing below 15 clients a week, then I really could only afford to have 1 or 2 sliding scale appointments a week and still meet my income goals. I backtracked into that and calculated the math. So once I did that, I knew I could be comfortable offering these spots, which was honestly like very, very exciting to me. I was really pumped that I figured out that I could offer some lower fee spots, but in order to do that, I had to maintain my boundaries around my higher fee spots. So how did that work? Sometimes clients will come in and will say something like, hey, do you have any wiggle room around your fee? Or do you offer any sliding scale appointments? And a lot of times clients know that therapists do this, and there's nothing wrong with them asking. In fact, I'm glad when clients ask. So if a client says to me, hey, do you offer any sliding scale spots? I say, thank you so much for asking. I do, in fact. And I say, I keep 4 sliding scale spots in my therapy practice at any given time for clients who make at or below minimum wage. And then I say, very point blank, do you make at or below minimum wage? Sometimes people would say yes, and then I would say, awesome, I charge what you earn for 1 hour of work. So if you earn $17 an hour, that's what you would pay for therapy. I've had clients who are in that situation who are honestly like really stoked about that. And then they keep that spot for as long as they are going to be in therapy. I personally do not limit the number of sessions they can have at a sliding scale spot because I wouldn't limit the number of sessions a full fee client could have. Every therapist is different on this. If you want to offer sliding scale spots for a limited number of sessions, you can do that. But this is what worked for me. So I would let clients know if they made at or below minimum wage and I had a spot available, that then I could give them that spot. If a client said, no, I don't make at or below minimum wage, but this is still a really high fee for me, then I would say, I'm so sorry, I do save these spots for clients who make at or below minimum wage, but if you'd like me to refer you to somebody who takes your insurance or a lower price clinic or Open Path, which I'll link below, they're great. They help pair clients with sliding scale therapists. Then I would refer them out and I would make sure to help them find somebody who was within their budget. I personally do not have a sliding scale where I slide maybe $10 or $20 off of my fee because I know that I can't do that and still afford to offer those very, very low fee spots. Everybody is going to be different. So what is the moral of this story? The moral is that you need to think about your why, behind why you want to be offering a sliding scale. Then you need to do the math and think about what is sustainable for your practice. And then you need to have clear policies, procedures, and boundaries around your fee. That starts with your paperwork. I have a paperwork packet, which I'll link below as well, but make sure to put your fee very clearly in your paperwork, put your sliding scale policy in your paperwork, and maintain those boundaries because that's what's going to help you have a sustainable practice for the next 30 or 40 years. I am super curious to know what your sliding scale policy is. Tell me in the comments and check out one of my next videos. I'll see you next time.